Representative Hudson, this is Josh. Jamie Glavich is signed on. We do have a quorum now.
Yeah.
Natalie Kelly is with Gloria Smith, so you won't see her name on there. And Mr. Davis is here at the department.
All right. Excellent. Okay, so we can get started?
Yes, sir.
Okay. Good morning, everyone. We're going to go ahead and get started. Apologize for the running a couple minutes late, but we had to make sure that we had a quorum to be able to make sure we could conduct the meeting appropriately. I will tell you, I've got a new little panel here to kind of help me run through and coordinate the meeting a little bit, but I'm going to rely on the assistance of the department in case I kind of botch up this little technology thing here. Hopefully I will not. If you have a question, please make sure that you raise your hand on the screen, and it'll appear on my screen, and then I can answer your questions as we go along. Let's see here. Okay, so to the agenda. I guess those would be my opening remarks, other than to say thank you for your work thus far on the various subcommittees. It's very much appreciated. We have as we discussed before, a great deal of work to do in a reasonably short period of time, and the subcommittee structure seemed to be the most logical way to try and accelerate the process and to get all the work done that needed to be done. To that end, I want to make sure that everyone received all the information that Josh sent out this morning. The website is now operational, and in the future, all meeting documents, as well as the minutes of the meeting, and anything that's going to be discussed from subcommittees and so forth, will be posted to the website. So take a few moments after the meeting to try and familiarize yourself with that website so that you're able to get the documents that you need. At this point, I'd like to take a look at some of the committee work that has been done thus far. We had a number of different committees that we put together. The Provider and Caregivers Group, the Associations Group, Law Enforcement Group, as well as the Research Committee. The Research Committee had not met because of some scheduling conflicts, but let's first take a look at the Providers and Caregivers Committee. Well, actually, stay right there. You got it up already. Committee meeting assignments. That's a good place to take a look. Essentially, what we have, each one of the committees was tasked with some research projects to be able to identify some of the materials within their expertise and their specialty areas, so that we could start putting together a more comprehensive picture, using the department staff to try and basically inventory where we stand in each of the different areas regarding, in this particular case, the provider and caregivers, which you see up on your screen now. The individual committee assignments for the participants of that committee are identified, and where they sit on those particular items. If you'll scroll down on that just a little bit, you'll see the next committee is the Associations Committee. And with the Associations Committee, you have a couple of members participating that are going to try and garner the information from various associations so that we put that together. Again, the idea is to not have a fractured approach, but a cohesive approach to understanding where we are going. The next committee was the Law Enforcement Disaster Preparedness Committee. And this one is going to deal not only with disaster preparedness, but how we the issues surrounding Baker Act, Disability Act, things like that. We will have a a number of statistical things that will come from this. And to that end, one of the things that was asked for by the committee members was to maybe have a template worksheet to work from, and those have been kind of created in Excel spreadsheet format, which will allow for a little bit more concise document gathering and information gathering. I think that should be helpful to the participants. At this point, again, the research committee has not met yet. The goal of the research committee is to kind of get a comprehensive look around the state of Florida at what is actually being done from a research standpoint, so that we have an idea of how many dollars are being spent in Florida, how many NIH dollars we might be bringing into the state of Florida for research at our state university systems and memory disorder clinics and so forth, so that we can have a better picture. I can tell you as a legislator, the majority of my colleagues would not really have an idea as to how much money is flowing into the state and is being utilized for research in this state regarding this particular issue. And I think it's important to highlight that, because as we are looking at targeting where problems exist and where opportunities lie, it's important that we know the entire picture. And so that will be the purpose of the research committee, and they will be meeting in the future. At this point, I think I will take a moment before we go too much further and just check to see if there are any questions and or comments from anybody in the group that might want to comment on anything thus far. So would you raise your hand? I saw Gloria Smith raise her hand. Go ahead, Gloria.
This is Natalie Kelly. I'm actually with Gloria Smith today, but actually it's not about any of this. I wanted to say this before the meeting started, but I just wanted to congratulate you, Representative Hudson, for your win. So we're glad to have you back in the legislature.
Thank you. It's good to be back. Otherwise, this would have been kind of a sad meeting today for me, to be honest. So,
Exactly.
but thank you for that. Let's see. I see Mr. Albert Johnson has his hand up. So go ahead, Mr. Johnson. What can we do for you? Mr. Johnson, are you there? Okay. I'm not sure. Maybe that was just a technical glitch there. Okay. If there are no other comments or questions, let's move on to the next item on the agenda. Talking about some of the committee work and talking a little bit about some of the assigned tasks. We've already done that, but I think it's important to recognize that we do have a very tight window, and the individual committees have really a deadline of November 30th to try and procure all this information and to have it in place. It is extremely important that we do that, so that the department has enough time to aggregate the data and to put it into a usable format so that we can start formatting our report. You should have been emailed this morning the reports of the individual task forces that already met, and I will not go through each one of those in its detail, but I would encourage you as members of the overall task force. They're not very long. They're just brief little kind of recaps of the meetings that occurred. I would suggest that you review those. If you're not on that particular task subcommittee, I think it would be important for you to review it so that when we start to put everything together, we are not going back and reinventing the wheel in terms of bringing everybody up to speed. Everybody has their own areas of expertise, obviously, but it will work better if we're all working together for that. There will be some additional meetings that have been asked for regarding the committee meetings. The Provider and Caregivers Committee has asked for a meeting to discuss gaps in services, and that one will certainly be facilitated. And obviously the Research Committee needs to meet yet. Is there anyone from the Provider or Caregiver Committee that would like to discuss what the goal of the gaps in service meeting will be about? Someone want to raise their hand and share? Samira Beckwith has her hand up. Samira, welcome. Please, what can you share?
Right, thank you, and good morning. And I'm so pleased that at this meeting I can actually have my computer working correctly. So I apologize for that last meeting when I listened to everything, and it was so frustrating not to be able to actually talk. So it's good to be here with you today and have my computer working. You know, we're really, I will speak for myself for this subcommittee, we're really excited about looking at not only what exists, but also the gaps in care. And that's why we feel like we need that additional meeting so we can strategize about how to best identify those gaps. Because, you know, when we were having the conversation, it does seem to be that that is one of the major questions so that we can look at how to address those gaps in the future. We don't want to suggest ideas that really are either already covered somewhere else or maybe not pertinent to what the needs are. So that's really our rationale in wanting that next meeting so we can begin to go through some of that information.
I think that is an excellent idea and really one of the core principles of what we're trying to accomplish. We know we're doing a lot of things in the state of Florida. We may not always know what everybody else is doing, so that's step one, but also to find out where the holes are in the system so that we can fill those holes or hope to fill those holes in an appropriate manner. So that's a great idea.
Okay. Well, my concern, can you still hear me?
Yes, absolutely.
Okay. Well, one of my concerns is when you just mentioned that November 30th date, is that to have the report ready, or is that to have more information available so that we can continue that study?
That is to have the information available, certainly not to have the report done.
Okay.
That is to try and have the information done. The report is not due to the legislature until January.
Okay.
The fact-finding missions really need to be done by the, hopefully towards the end of the month so that we can get it to the department. The department can start to aggregate, put it together, and the challenge becomes obviously because of the holidays, obviously at the end of this month, and then all the holiday activity in December, we lose a significant amount of time just to be able to meet with quorums and so forth. And so the goal is to try and get the data in. And remember, it's a preliminary report in the end of January with our final recommendations coming after in the summertime. So we have some time, but we don't have much. So that's the idea of November.
Thank you.
Yep, I see another hand up. Christine Powers has her hand up. Christine? Christine, are you there?
Can you hear me now?
I can hear you now.
Hello?
Hello.
All right. Okay, I just wanted to add a little bit from the Caregiver Committee and the purpose of that meeting. We had come up with kind of three elements or three goals, and one was obviously to take a look at the inventory that's presently, take a look at the gaps, but also taking a look at the utilization of the services and programs that are out there, and if they're working efficiently and effectively. We also identify the fact that how we did things 10 years ago, how we're doing them now may not be applicable to the future. So we decided to come up with perhaps doing a caregiver survey to help identify those needs and to see what might be working out there, and from their perspective what they feel would be more effective in the care of their either loved ones or whomever they're taking care of in dealing with the Alzheimer's disease.
Okay, excellent. That's a very nice segue. Thank you for the next item on our agenda, dealing with a discussion on doing a survey. And so you've kind of opened up the idea as to what we're trying to accomplish with a survey. And I know a couple of folks had emailed in some suggestions for a survey. I think to me it's important that we, while all of these meetings are certainly open to the public, I think there's a reasonable belief that not everybody is going to know about this, and not everybody is going to clamor to find a place to go to a webinar or even log on at home. As much as I might want to think that this is the most important thing in the world, I realize that other people aren't quite as nerdy as I am, and probably are not going to dig into some of these things in the general public. So I think it's important for us to go to them, and so the idea of a survey to me makes some reasonably good sense. Are there some questions or suggestions regarding the survey? And I know that staff will be taking down any of your comments or thoughts. Christine, I think, brought it up very well. I see if you have any questions, by all means, raise your hand. I see that Dr. Graf Radford has his hand up, so let me recognize him. Go ahead, Doctor.
Hi, Representative Hudson. Thank you very much. And I think we should really be inclusive of Alzheimer's and related diseases because there's quite a large group of non-Alzheimer dementias that come under this umbrella, like Lewy body disease or vascular dementia or frontotemporal dementia. All of these people land up in nursing homes or have care. So I think that if we broaden our name and call it Alzheimer's and related diseases, I think we could address that particular issue.
I think that is a very good point. As it was designed, it was supposed to be Alzheimer's and other related dementias, so I think that that is in keeping with what our goal is, and so I think you're right on track with that. We have another hand up. Let me get to that one. Christine Powers, you are recognized.
Yes, I had a couple of questions that I wanted, and I think I addressed them when I sent in my comments on the survey. But the information that we're going to be applying to that survey, I think, has to be relevant to what it is that we're looking for in order to base the state plan on. So, in other words, the Iowa or the Iowa-Oregon survey, they're asking demographic information such as age, income, and I'm wondering, is that really important information, or can we find it elsewhere? When you're applying a survey, you want to keep it simple so that people will respond to it and not have to be on the survey and have to give it a lot of research before they can complete it. And likewise, my second question is, how would this be administered? Would this be administered via the internet, mailings, distribution? I think we need to think about, if we're going to do a survey, how do we get it out to the public to be completed?
I think those are excellent points. I agree with you. I think that some of the demographic and that type of information can be garnered from census sites, from Bureau of Economic and Demographic Research from the state. I'm not sure we need to include that in the survey. I think there is a definite advantage to keeping it concise to the point, so that people will respond. I think people are spot on when it comes to that. If you give them the 8-page survey, they're just not going to do it. They need shortened to the point to actually be able to facilitate it properly. In terms of, in terms of being able to reach out to folks, I think we would be looking at a web-based survey. I think it would also then be distributed out to various databases that are at the disposal of the department, and to maybe the organizations that are involved in this committee, to be able to solicit feedback through that survey process. I think that is probably the most cost-effective, and also probably the easiest to facilitate. Mail surveys these days get very, very tepid responses, and I'm not sure that's where we want to go. 1 second. Christine, you have a comment. You're recognized.
Yes, I just wanted to continue the comments. I agree 100%. The other thing is that we were looking at doing a survey for the caregiver, and as I was processing some of the questions that I had to propose on that survey, it came to mind that one of the big legs of the stool would be physicians. Now, I know it's next to impossible to get a physician to fill out a survey, but I don't know if there's any way we could be creative to either garnish that information from office staff. And then the other survey, rather than surveying a person with Alzheimer's, because I don't know how effective the planning would be unless we can get somebody in their early stages to be able to share their fears and their concerns. But, you know, taking a look at the aging network out there to see their perspective on it too, and those are just thoughts.
No, and they're good thoughts. What I would ask of department staff, and Josh, I assume you're on the call, I would suggest that we, when it comes to the physician side, because that is an important factor, obviously, I think it would be worthwhile for us to reach out to the Florida Medical Association as well as the Florida Hospital Association to look to see if through their network they might be able to help facilitate some responses in that regard. I think that could be helpful to us. It might circumvent the just getting lost in the email type of problem that we could potentially have. I agree with Christine. Seconds here, we have Samira Beckwith. You're recognized.
Oh, okay. I was also thinking that it would be great to reach out to the Florida PACE Association and the Florida Hospice and Palliative Care Organization.
Yep, I think that's probably a good group as well to reach out to, and I'm sure Josh is furiously taking notes.
Thank you.
I did see Gloria Smith with her hand up, or perhaps Natalie Kelly, not sure. Gloria or Natalie? No? Maybe? Maybe not?
Yes, I'm sorry. This is Natalie Kelly. I suggest that we send it to Florida Council on Aging because they have a network of a lot of different organizations under that umbrella, and if we could send that out, we'll be hitting a lot of different senior organizations that really kind of go beyond Alzheimer's.
I agree, and certainly when we want to take advantage of the ADRC network as well. I think what I would ask is that the folks on the subcommittee on providers and caregivers, if you would email Josh your suggestions of what organizations would be good to disseminate this through and the point of contact for those organizations, whether it's yours or another, I think that would be very helpful to the entire process. To the entire group, I would also say that it's important that any suggestions you have for survey questions, they really need to be submitted as quickly as possible so that we can put together a draft survey. We'll distribute it to the group so that you can see what you like or don't like, and then we will have it. Next up, let's see, we have Linda Levin. You're recognized.
Yes, I was thinking we're trying to here with work on one of the other committees. I've asked my staff to see if we can map all the resources that are in the ADRC's resource database that serve dementia, because we can identify that. So that map could be used, if we can get it mapped, both to look at where the resources are that serve dementia and what they provide, but also may be able to use that list to also send the surveys out. It's a pretty robust database that's statewide. It would be pretty easy to do, I would think. So keep that in mind also.
Okay. Linda, I have to tell you that we're getting a lot of feedback on your audio, and it's very difficult to hear what you had to say. I picked up a little bit of it, and I'm sure the group picked up a little bit of it. What I would ask is if you could send a short email to Josh with your comments so that we know that we have exactly what your thoughts are. that would be helpful. He'll share it with the group. But if there's audio problems, unfortunately. So if you would share that, we'd appreciate it. Okay. Let's move on to the oh, wait a minute. We have a hand up here, sorry. Dr. Graf Radford, you're up.
Just two other suggestions is to survey the medical schools as to the training of looking after people in this area, like geriatricians, primary care, and fellowships in dementia-related diseases would be of interest, I imagine, to the legislators, and perhaps we could send out a question to our medical schools as well. Also, it would be actually very interesting. I don't know how we could do a survey of how many skilled people in this area are in the state of Florida that specialize in the area of care of dementia patients. That's the one point. The other is I would ask all the members of all the committees to ask the Alzheimer's Disease Initiative group to contribute their knowledge to the particular area, whether it be caregivers or nursing homes. They have a very good inventory already of a lot of this, and I think asking their input would be really helpful. Those are the 2 points. Thanks.
Thank you very much, Doctor. And I could not agree with you more. I think there definitely needs to be an outreach to the various medical schools in the state. We've invested a great deal of money over the last few years to create additional medical schools, and I think that that is extremely important information for us to get. I would also let you know, Doctor, that in the association's subcommittee, one of the tasks is to get the statistical information from the ADI folks so that we get that information and we're not duplicating efforts that way. So hence part of the reason why I want the subcommittees to get their work done by the end of the month so that we don't duplicate anything. Everybody's time is precious. I do want to just mention to the group, by some strange happenstance at the department today, they're going to be doing a fire alarm drill at 10 a.m. And so it would probably behoove us to try and wrap up just by 10 o'clock so that we're not hearing some very strange piercing audio sound and putting our staff getting in trouble by not participating in the fire drill.
Representative Hudson.
Yes.
This is Josh. Linda Levin submitted her comments, so I can repeat that all for the group real fast based on this.
That would be great because her audio was very difficult, I think, for a lot of folks.
Absolutely. Through the ADRCs and the Florida Association of Area Agencies on Aging, they've asked staff to map all the resources statewide in a database for individuals with Alzheimer's disease and related form of dementia. They can reach out and use that map to see where the resources are, what they are, and where there may be gaps, and they can also use that list as one of the distribution lists for a relevant survey that we put together.
Excellent. Okay. Very good, and thank you, Linda, for shooting that email off so that we could all get your comments. Okay. So that brings us down to agenda item number 5, where we're just really kind of talking about the timelines again. The goal, of course, is to get the data submitted by the end of the month. The next thing would be that the department will aggregate all the information during the week of the 7th. We'll have a task force meeting the week of the 10th of December so that we are prior to any of the holiday activity so that people will not have to be calling in from remote spots around the country where they might be traveling. And at that meeting, I would think we would certainly have had a draft survey put into place, and we can have a finalization of that. And then as we look forward to January, or at least I'm looking forward to January, we will have a task force meeting the week of January the 7th. And that will really be to discuss the interim report. And my goal is that additionally at the December 7th meeting, or the December 10th meeting, excuse me, that we will start to discuss the format of how the interim report will look so that we can have a discussion on a copy of that interim report that first week in January, and then finally the last week of January actually approving our interim report. Now remember, this is more of a report. It is not recommendations yet. And while I know that there are probably a ton of recommendations floating around in each one of your thought processes now, really what we're doing now is truly the report work in terms of getting the information, putting it together, give us a guide map so that we can in fact make good cohesive recommendations, and that is the ultimate goal. Josh, do you have anything that you'd like to add from either something from the Secretary or anything that you'd like to share with the group, anything that I may have missed that you feel might be important?
This is Josh. You hit on pretty much everything that I know we've been working on here. The Secretary was not able to make it today. He's actually traveling for a Workforce Florida board meeting, but I will update him. And I guess the only thing I would add is we've received some information and some helpful comments from a couple of the task force members on the surveys. As you mentioned, if additional members have recommendations on questions to be added, I'll be sending an email out today that will have a timeline so that we can start working internally and get that put together and get that to the task force in a timely fashion so we can get that approved and distributed. And I'll sort of reach out as well on, we took notes on the different associations and entities, so I'll work with those members that have a relationship with or relationships that we have at the department on putting together a master list of who all that would go to. And also, we'll be within the next week nailing down all the future meeting dates through the interim report, and at the recommendation of Linda Levin, we'll be using an online software that will be a little easier for everybody to indicate when they're available and get that on their schedule as far out as possible. So I guess that's sort of all the comments that we have here at this point.
Excellent, and I would just mention to the group the reason those dates were selected, aside from the fact that we have to be done by the end of January. The legislature will be convening for committee weeks during some of those periods of time and trying to coordinate schedules and so forth. That's kind of why we did what we did. I see Christine Powers has her hand up. Christine, you are recognized.
Yes, thank you. I don't want to sound naive, but I've got a question now. Once we submit the report in January, I'm assuming it's distributed to the legislators. They then review that, and do they return it to us for putting into final draft, either a final draft to be presented as a final form? And if they do, what type of timeline would we be looking at for the return of that information?
Okay, well, that is not a naive question. It's a good question. And the interim report is a report to the legislature. It will be submitted to the governor, to the Senate president, and to the Speaker of the Florida House. It is a document that is required by law through the legislation to be submitted to them. It will help the legislature in both chambers understand a great deal as they, as staff looks at analyzing bills that might come before the session this year. You know, we have obviously some new legislators that just got elected here the other day, and so legislators will have an opportunity to have that. We'll have an understanding of by seeing the interim report and all the statistical research, have some better understanding of the process of what's going on in the state. They hopefully will have some understanding of the issues surrounding Alzheimer's and other related dementias. The ultimate goal is for us to monitor, of course, what bills might come before the legislature this year, but make some specific recommendations that will come forward later in the year. As we get done with the interim report, there were two kind of phases. Number one, get all the information together, and then us as a group also sitting down and saying, okay, now we know where we're at. What can we do to make some specific recommendations in the form of policy directives that we can now submit to the legislature? Realistically, legislators might file some bills this year that we were going to make recommendations for later in the summer. That could certainly happen, and that would come off of our list potentially. But the goal is to inform and educate with the interim report, allow the legislators to be knowledgeable of what's going on, and then from there, us make specific recommendations based upon our fact-finding and the actions of the legislature in the spring, some specific recommendations that we can put into the form of a report that would be, in my opinion, some immediate goals, some short-term goals, and some long-term goals as to where we want to go. Ultimately, the legislature might choose to act on those things, and they might choose not to, but ultimately, I think you have to give them some guidance that way, and the first step is to give them the knowledge to be able to move forward. I did see a hand up here, either Gloria or perhaps Natalie. Not sure which one clicked on the button there, but you're recognized, one of you.
Natalie's hogging my microphone.
You know what? She's like that. It just like that.
Hey, Mr. Chair, Committee.
Yeah.
I suggest that in addition to a written report, if there is a possibility that before the January 30th deadline, I guess it's the second committee week in January, that we have an opportunity to go before certain committees, certain healthcare committees, and just make a presentation, a brief presentation, just an overview of what we've done and where we're going with this, so that they're actually aware of that there is a report now that was submitted, an interim report. So.
Yeah, I think that's a good idea. You know, obviously with the election, we do have some new members. We will have a organization for everyone on the call. Just a quick civics lesson here. The Florida Constitution requires that there be an organizational session within 14 days of the general election, and that will be scheduled for November the 20th. At that time, the new speaker will be installed as the leader of the Florida House, as will the Senate President. From there, all the committee assignments will also be put forward. All members of the Florida House have a November 14th deadline of submitting their requests for committees. And so while I think it's a very good idea to potentially do a presentation, the question at this point would be, we don't really know who committee chairs would be to reach out to or any of that yet. But certainly, I think you have a chairman and a co-chair in the Senate that would certainly be desirous to see something like that happen. So we'll see who gets selected to be various committee chairs and see what we can't do to facilitate that. But I think that is an excellent idea to make sure that legislators are aware of it in more of a personal format rather than just a document that's being delivered. Okay. Oh, wait. We have another hand up here. Amy Perry, you're recognized.
Hi. Thank you, Chair Hudson. I just wanted to, mention that as we look at the continuum of Alzheimer's care in these various committees, I hope the task force will also focus on early intervention and prevention. This may be an area that the research committee considers because through identification of mild cognitive impairment and when we're able to catch or, identify Alzheimer's disease at its earliest stages and intervene, we are improving quality of life and we're really extending our patients' ability to live independently and take some of that pressure off the caregiver. This has a significant financial impact for the state, and so I'm hoping that the committee will also look at this potential opportunity and savings for the state, and it possibly is a subject for the research committee. I'm not sure, but I wanted to put it out there.
Thank you very much, Amy. I think that is a very valid suggestion, and one that certainly could be brought forward to the research committee. I don't think that's a bad idea at all. I see another hand up here. And by the way, before I recognize anybody else, we are basically at the end of our agenda, and so at this point I'll take questions from the rest of the members. And then I do see a couple of members of the public that are also on the call today, so if they have any questions, they're more than welcome to be able to have some public comment at this point as well. So next up, Christine Powers, you're recognized.
Okay, again, I'm not sure if this is a appropriate question or a dumb question, but would it be a thought to provide not only this draft, but the final copy to our federal representatives and senators so that they can gain the insight, what we're doing here and what we propose as a state, and perhaps take it forward and in their decision making as things come across their desk on a federal level, to be able to have that information to, work with the state?
Well, certainly there's absolutely nothing wrong with anyone else getting this document. It's certainly not going to be a protected document by any stretch of the imagination. In fact, we want it to be a very public document. The law that this task force was created on specifies, because we are a Florida-based group, that we would be presenting this document to the governor, Speaker of the House, and the President of the Florida Senate. That does not mean that once we get a final work product, that we certainly could not forward it to our congressional delegation. There's absolutely nothing that would prohibit us from doing that. But initially, we must, by law, submit it to the three folks I mentioned before. But there's nothing that would keep us from distributing it to everybody we absolutely possibly could to make them aware of this issue, because that is kind of the underlying current of all this, is also the awareness piece of what we're doing. So with that, are there any other members that have a question or comment? Okay, I see Samira Beckwith with a question, and you are recognized.
Yeah, thank you. I wanted to reference the map of services and gaps and different kind of items that we've been talking about that a speaker, I'm sorry that I didn't catch the name, had talked about that I believe that was FCOA had done, and just wondering if we can get a copy of that.
Well, I don't see why we couldn't. I think that Josh can probably facilitate that and get that shot out to everybody.
Thank you.
Absolutely.
Excellent. Okay. Anyone else with any questions, comments, concerns? Any member of the Samira, do you have another one?
No, I'm sorry. I didn't hit it again. Don't know what happened.
Okay, not a problem. I just thought you were putting your hand up and waving at me there for a second.
It was a thank you so much for a good meeting.
Okay, well, with that, members, we are adjourned, and I will let the folks at the department go run and do their fire drill, and we don't have to be a part of that. So thank you very much for your time and attention and for your excellent work thus far. Members, we are adjourned.
Thank you.